Zeroburn 2% Topical Gel Local Anesthetics is a medication used on the skin to relieve itching and pain from skin conditions like scrapes, minor burns, eczema, and insect bites. It can also treat discomfort and itching caused by hemorrhoids, anal fissures, and itching around the vagina/rectum. Additionally, it can decrease discomfort or pain during certain medical procedures/exams such as sigmoidoscopy and cystoscopy. The active ingredient, lidocaine, works by causing temporary numbness/loss of feeling in the skin and mucous membranes. The recommended daily dosage and optimal timing for using this medication should be consulted with a healthcare professional. When using Zeroburn 2% Topical Gel Local Anesthetics, it's important to follow the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. Before applying to the skin, clean and dry the affected area as directed. Apply a thin layer of medication to the affected area of skin, usually 2 to 3 times a day or as directed. If using the spray, shake the canister well and hold it 3 to 5 inches from the affected area. If the affected area is on the face, spray the medication onto your hand and apply to the face. Do not spray near your eyes, nose, or mouth. If using the foam, shake the canister well before using. Spray the foam onto your hand and apply to the affected area. Avoid using on large areas of the body, covering the area with waterproof bandages, or applying heat unless directed by your doctor. These actions may increase the risk of serious side effects. Wash hands immediately after use unless treating an area on the hands. Avoid getting the product in eyes, nose, or ears. If it does, rinse the area immediately with clean water. The dosage is based on your medical condition and response to treatment. Do not exceed the recommended dosage or frequency of use unless directed by your doctor. If there is an infection or sore in the area to be treated, consult your doctor before using this medication. If your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help right away. When using Zeroburn 2% Topical Gel Local Anesthetics, you may experience temporary redness, stinging, and a little bit of swelling at the application site. If these effects persist or worsen, it's important to notify your doctor immediately. If your doctor has prescribed this medication for you, they have determined that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. Seek medical assistance immediately if you experience any severe side effects, such as slow or shallow breathing, seizures, pale or bluish skin, extreme fatigue, shortness of breath, or irregular heartbeat. While a severe allergic reaction to this medication is rare, it's crucial to seek medical help if you notice symptoms such as a new or worsening rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. As for the daily dosage and optimal timing for taking this medication, it's best to follow your doctor's instructions. If you have any concerns or questions, don't hesitate to reach out to your healthcare provider for guidance. Before using Zeroburn 2% Topical Gel Local Anesthetics, make sure to inform your doctor or pharmacist if you have any allergies to lidocaine or other types of anesthetics. It's important to discuss any medical history, especially if you have broken skin or an infection in the area where the gel will be applied, as well as any heart or liver disease, or a certain blood disorder. If you are scheduled to have an MRI test, it's essential to inform the testing personnel that you are using this product, as some brands may contain metals that can cause serious burns during an MRI. It's also important to discuss the use of this medication with your doctor or pharmacist before undergoing surgery. It's crucial to note that children may be more sensitive to the side effects of this drug, so it should be used with caution. If you are pregnant, this medication should only be used when clearly needed, and the risks and benefits should be discussed with your doctor. Additionally, if you are breastfeeding, it's important to consult your doctor before using this medication. When using Zeroburn 2% Topical Gel Local Anesthetics, it's important to be aware of potential drug interactions. These interactions can affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Always seek your doctor's approval before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of ZeroBurn 2% topical gel local anesthetics. If this medication is inhaled or swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help right away. For those in the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include drowsiness, irregular heartbeat, and seizures. As always, it's important to take this medication exactly as prescribed by your doctor and to follow their instructions carefully. If you have any concerns about the dosage or timing of taking this medication, be sure to consult with your healthcare provider. Make sure to use ZeroBurn 2% topical gel as directed by your doctor. It is important to follow the prescribed dosage and apply the gel to the affected area as recommended. ZeroBurn 2% topical gel can provide relief from itching, pain, and discomfort caused by minor skin irritations, insect bites, and minor cuts or scrapes. It is best to apply the gel at the first sign of discomfort, and it can be used up to 3 to 4 times a day. Make sure to wash your hands before and after applying the gel, and avoid getting it in your eyes, nose, or mouth. If you have any concerns or questions about using ZeroBurn 2% topical gel, be sure to consult with your healthcare provider. If you are using ZeroBurn 2% topical gel on a regular schedule and you happen to miss a dose, use it as soon as you remember. If it is close to the time of your next dose, then just skip the missed dose and continue with your regular schedule. Do not double the dose to make up for the missed one. It is important to stick to the recommended dosage and timing for the best results. It is important to store ZeroBurn 2% topical gel local anesthetics at room temperature and away from high heat. Make sure to keep it out of reach of children and pets. Do not store it near open flame and do not puncture or burn the container. When it is expired or no longer needed, consult your pharmacist or local waste disposal company for proper disposal. Avoid flushing it down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.